Well, good afternoon, and thanks again for joining us. Happy Friday and also happy Memorial Day weekend. Today I want to talk about where we are on our testing and highlight a new tool that will help people assess their symptoms and find a place to get tested. First, let's look at a couple of slides about our testing data. Yesterday, we got results of 6,543 new PCR tests and 1,438 serology tests. As you can see from this slide, the percent positivity from testing continues to trend downward. Statewide, it is at about 15%. And on this slide, you'll see the number of tests continues to trend upward. Both of these are good things. We know that there are simple steps that all of us can take and should to help stop the spread of this virus. We know they work, and we know that these guidelines will be part of our new normal as we continue to move forward. You've heard me say this before. Please wash your hands. Stay 6 feet away from other people and wear a face covering in public. We know that when most people wear masks, that goes a long way toward reducing the spread of the disease. As I have said before, wearing a mask could literally save someone else's life. That is becoming clearer every day as we move further into managing this virus over the long term. Face coverings are an important part of the next steps, and we will have more to say about that next week, especially as we think about Phase 1 and Phase 2. I know everyone is wondering when Northern Virginia, Richmond, and Accomack County will be able to move into Phase 1, and when the rest of the state will move into Phase 2. We are in frequent communication with officials in those localities, and we'll have more information to share next week. But to be clear, the floor that we establish will not change. Today, we're launching a new symptom checker that will help people assess whether they should see a doctor, self-isolate, or get tested. The Virginia Department of Health is launching COVID Check. I'll repeat that, COVID Check, a new telehealth and online risk assessment tool. You can go online to the VDH website and answer questions about your symptoms, and the tool will give recommendations about what to do next, such as self-isolation, seeing your doctor, or seeking emergency care. It also can give you options for where to get tested near you. As we have talked about, testing and tracing are critical pieces of this puzzle as we move forward. VDH is in the process of hiring the tracing workforce that we need. And we keep expanding our testing capabilities. We are doing large-scale community testing with the VDH and in many cases the National Guard as well as private contractors. We're working to partner with pharmacies for testing, and we continue to ensure that doctors' offices and clinics are able to access testing. This week, we did more than 4,000 tests at community events in Woodbridge, Manassas, and Leesburg. The Virginia National Guard has done almost 11,000 tests as of this past Tuesday, and will have done 9,000 this week as of Sunday. Next week, we have planned 44 community testing events, and we anticipate that will include 17,500 tests. We'll also be doing point prevalence surveys in approximately 15 facilities with 6,000 tests. And speaking of the National Guard, yesterday there was flooding in Southwest Virginia. Members of our National Guard worked with the Division 6 Swiftwater Rescue Team members from Roanoke Fire EMS to rescue 116 people, 4 dogs, and yes, 2 birds in Roanoke. I have spoken previously about how grateful I am, and how grateful all of us are to our National Guard members for their service during this time. And this is an important reminder of how much we rely on the National Guard for help during emergencies of all kinds. Now I'd like to highlight an important step forward for the more than 740,000 Virginians who rely on the Supplemental Nutrition Assistance Program benefits to feed their families. We also refer to that as SNAP benefits. This week, the USDA has approved a pilot project from our Department of Social Services to allow SNAP recipients to order groceries online and to also have them delivered. This will launch next Friday, May the 29th. To start, this online shopping access will be available through Amazon and Walmart. Other retailers may be accepted into the program by contacting the USDA. This will help families get access to nutritious food without having to leave their homes. For families with small children or with members who have underlying health conditions that put them at greater risk, this will help keep them even safer. I want to thank Senators Mark Warner and Tim Kaine for their work to make this pilot project happen. Yesterday, we received the first monthly unemployment report that really shows the impact this pandemic is having on our employment in Virginia. As you know, we had enjoyed a low 2.8% unemployment rate prior to COVID-19. For April, however, our unemployment rate rose to 10.6%. This is expected, as we now have approximately 720,000 people in Virginia who have filed for unemployment, including 44,000 new claims this past week. There have been reports that I realize individuals, Virginians, are having difficulty getting their unemployment benefits. So I'm pleased to announce that we are opening up a new call center with 315 additional employees to help handle those requests. This is the season when Virginia high school and college seniors would be graduating. The pandemic has turned all of those celebrations literally upside down. I am sorry that graduates across Virginia will not get to commemorate this achievement with their friends and their families. However, Virginia Public Media, who also helps with these presentations, by the way, has worked to create a virtual graduation ceremony. Virginia Graduates Together will air next Friday on public television stations across the state as well as online. Members of the class of 2020 can send VPM photos, messages, videos, and more at vpm.org/grad. I'll repeat that again, vpm.org/grad. And please do that by Sunday. Our staff has really played a large role, put a lot of effort, and I think our graduates will find it really good, and I think they'll also find that there are some special guests that they will enjoy that will be speaking to them as part of that graduation ceremony. I want to say Eid Mubarak to all Muslims across the Commonwealth. For those planning Eid prayers, please remember to follow social distancing. This year, Ramadan and Eid have fallen in the middle of difficult times. Both Pam and I join in wishing you all a blessed and joyous celebration. And finally, this Monday will be Memorial Day. It is hard to believe we are already at the end of May. These past 3 months have felt both very fast and very long. I want to take this time to recognize all of the members of the military who have given their lives to defend our nation. Since World War II, nearly 13,000 Virginians have died in the line of duty. As we head into the weekend and on Monday, I ask all of you to remember and reflect on those sacrifices and remember the loved ones left behind. Our flags will be at half-staff to honor their sacrifices. The Virginia War Memorial holds a Memorial Day ceremony every year. This year, it will be virtual, and I would encourage everyone to tune in to that ceremony on Monday morning at 10 a.m. Additionally, state flags will be flown at half-staff to honor people who have died from COVID-19 pandemic. They are our friends and our neighbors, and they leave behind families who love them, and we all mourn their loss. I want to remind Virginians of a couple of other safety issues as we head into this weekend. One, as I mentioned earlier, it has been raining a great deal across much of the Commonwealth, especially in the Southwest. That means rivers are up and flooding is possible. Be aware of river restrictions and local weather forecast. And two, even though this is normally a holiday weekend, we still need everyone to be smart and safe this weekend. Don't gather in large groups. Don't crowd parks or natural areas. Remember to maintain your social distancing, and please wear a face covering when you're out in public. Now I'll ask Dr. Norm Oliver to give us a health update, and then we'll be glad to take your questions. Dr. Oliver.
Thank you, Governor. Briefly on the case report for today, we currently have 34,950 cases of COVID-19 as our total number of cases. That's 813 new cases in the last 24-hour reporting period. The total deaths stand at 1,136. That's an increase of 37. Governor Northam mentioned the number of PCR and serology tests that we had in the last reporting period. African American cases stand at a total of 5,285, which is about 22% of all of our cases. The deaths among African Americans stands at 234, which is about 24%. For Latinx people, the cases stand at 10,977, or about 47%, and the deaths in that community at 90, which is about 10%. Thank you.